Hi, I'm Sharon Thompson, and thank you guys for staying. I know there's maybe a tendency after lunch to vamoose, so I appreciate your attendance. I direct the Community Engagement and Dissemination Core for the Center with Dr. Teresa Bird. She couldn't be here with us today, but she is an associate professor in the University of Texas at Health Science School of Public Health. And she was actually my professor when I was an MPH student, so it's great to work with her as a colleague. And Holly Dempsey will be talking about some of the projects that we've been working on as part of the core. So just the general purpose of the core is to support the efforts of the center. We want to translate the investigators' findings and observations to healthcare providers, foundations, community groups, and others with the goal of decreasing Hispanic health disparities. We also want to disseminate findings of the center to Hispanic populations served through the media, including the internet, publications, conferences, and other dissemination venues. And essentially, essential to this dissemination process is the community. We, like Dr. Castaneda talked about in the introductory remarks, we don't want to disseminate information that the community is not interested in. We don't want to do things that the community doesn't have a say in. We want the community to be a part of the process from the beginning. As such, we formed a community advisory board with community partners, and they're going to be informing the center throughout the whole process, from what kind of information are they interested in, how do they want to receive the information, in what venue, do they want internet information, or do they prefer hard copies, do they like town hall meetings? So this is all integral to this part of the core. Specific aims, we're going to create strategies in collaboration with the center researchers to translate findings and observations to clinical and public health practice in order to decrease health disparities, disseminate research findings, funded studies on Hispanic health disparities using both community partnerships and established scientific venues. And what we kind of consider what we do is representational advocacy. So we, as part of the core, we want to speak on behalf of disadvantaged populations, addressing structural and society barriers to health equity, or promoting the rights of particular groups who have historically been underserved. So we consider this representational advocacy in action. And part of what we have been doing these last couple of weeks, I teach a community health methods class. And if the community health methods, you can see some of us are in uniforms. If you students could stand up, I'd like to recognize you all. Don't be shy. Yay. So these students started with me 3 weeks ago. And the first day, in fact, I think I emailed you all on WebCT before the class even began. And I said, we're going to plan, implement, and evaluate health education intervention in the 4-week time frame. And they probably thought, what's this crazy lady talking about? But these are our future public health educators, and they need training with actual experience. And we can talk about methods, but these students need to actually do that. So we have planned, implemented, and Holly and I have been evaluating the students' presentations all last week and the beginning of next week, and they've done a phenomenal job. The future is very bright for public health educators in our community. They're creative, energetic, and they're grounding their intervention in sound theory and also evaluating their intervention to determine if it was effective. So they've really gained wonderful experience, and as part of that is central to the Hispanic Health Disparities Research Center. These types of programs do take funding, and the center was generous enough to support this project so we could do this type of activity, which we may not otherwise have been able to do without this funding. And Holly is going to talk about the specifics of the project, but I'd like to also explain what Holly Dempsey is doing. She's a research associate in the College of Health Sciences at UTEP, and she also directed this service learning outreach program. She is probably going to be, we say we never want her to leave, but she is probably going to take an academic position when she finishes her doctorate in interdisciplinary health sciences. And she will be training public health practitioners in the future. So this was an excellent opportunity for her to coordinate this service learning activity, which is central to the academic experience and development of students. So with no further ado, I'd like to turn it over to Holly and she'll explain the specifics.
Thank you. Okay, I get the fun part now. She had the theory part and what the center does, and I get the part which is, well, just get up there and talk about what the students did and how it relates to everything else that the center does. And so, so I probably have the least structured part of the talk today, but it was really interesting watching some of the other speakers talk about what the center does and what their goals are, and it really does all fit together, even though none of us got together and said, hey, let's all make our presentations fit and connect. But one of the things I wanted to mention first was there was a lot of talk today from Dr. Castaneda and from Dr. Morera about diversifying the scientific community. And without knowing what they were talking about, one of the things I wanted to highlight was a recent issue of the American Journal of Public Health was devoted entirely to diversifying the ranks of researchers who work in mental health and HIV/AIDS research. And a lot of what they talked about in this issue was applicable really to any research communities, and particularly in health sciences. And so I just wanted to talk a little bit about what that issue was about. It spoke to the need for what they called purposeful, intentional, and intensive mentoring of young people who are not fully represented among the ranks of our research community. And so they spoke of this need to, hey, we need to develop and diversify the ranks of our scientific community if we're ever really going to address some of the health disparities that exist out there. So one editorial in particular pointed out that we've done a really good job of increasing the populations in which we do research, which is one way of addressing health disparities, is broadening the populations that we study and figuring out how to address specific issues. It's one thing the center does very well. What you also heard talked about this morning once at the center is not only paying attention to who we're researching, but who's doing the research. And so just like in community-based participatory research, we're engaging our community, developing our researchers, training our researchers, mentoring our researchers, and that's going to enhance both the ranks of the research community and the type of research that gets done. So we'll talk a little bit more about that later, but one of the things that Sharon mentioned was the necessity for the community partnerships between UTEP and the community, between the center and the community, and anytime we get a chance to merge our goals in developing health professionals and preparing our graduates to go out and be health professionals, if we can merge that with the community's needs, that's a good thing. So what we did in this project, which is, we also did this last year, I'm going to focus mostly on what these guys did this year, but just for a little bit of background, we were able to take, to meet the goals of educating our students and giving them the real world practice that they need with the needs of last year, the community in general in El Paso, and this year, the UTEP community in disaster preparedness. In general, Americans are not very well prepared for disasters. The Red Cross says that about 7% of Americans would be prepared in the event of a natural or man-made disaster. It's about 1% in El Paso. So definitely there's a need for it. We know that proper preparation can minimize the impact of such events and save lives, and I feel kind of silly giving this talk because these guys could be doing it much better than me when it comes to disaster preparedness. They've been trained, they've been doing it all week long. They've had lots of opportunities, and I could literally call on any one of them and say, here, you take over, and they probably have some great learning activities that I don't have. So, but at any rate, last year, the class, and the 16-week semester class, so last year's class had 16 weeks to do what these guys did in 4 weeks. They went out into the community, provided disaster preparedness education, and here I'm going to give kudos to Dr. Tamaka because he did the analysis for this. What we found last year in a sample of about 350 people. And guaranteed a lot of the people
would like to do the analysis.
Many of those people clapping have been in a very similar position where they've been saying, thank you, Dr. Tamaka, for doing my analysis, helping me show me how to do it. So, but what we found last year out in the community was that as a result of the education that the students provided, people's perceived susceptibility to disasters increased, their self-efficacy regarding being prepared and being able to take action increased, their barriers to being prepared in the event of disasters decreased, and their understanding of the benefits of being prepared increased. So again, theory-based, health belief model type constructs that were tested, measured. We knew that the education worked out in the community. So this year we thought, well, hey, let's do it in the UTEP community. So the students last year and this year, they got to go out and work with different populations. You know, some groups were 2 people, some groups were 50 people. They got to practice, hone, and develop their community education skills, working with different types of people and adjusting their presentations to, you know, whether it was adults in their 50s or fellow college students. Also, kind of a neat aside in terms of developing our researchers is all of the students last year and this year took the self-assessment for health educators, which measures their perceived competence in the 7 areas of responsibility in health education. And last year, we don't have the data yet from this year because the students still have 1 more week before they take their post-test. But last year, in all 7 areas, students showed significant increases in how confident they felt going out there and doing their job as health educators. So to me, that's a really neat, you know, it really shows the benefit of the community partnerships is not only do the community members benefit, but our students benefit and end up walking away from the class feeling like, hey, you know what, I'm good at this. You know, I went out there, I did it, I made my own program, I learned what I knew from classrooms and theory and developed my activities and went out there and did it with all these different groups. And sometimes you walk in and you know, you've been told, okay, you're gonna have 15 people and they're gonna be there for an hour and this is who they are. And then you get there and guess what, there's 25 people and they say, well, we only have 35 minutes today. And so you just kind of adapt and you go with it. And that happened to these guys in a few instances and they did really well. So this year, just like last year, we partnered with the American Red Cross. Where's Jonathan? Oh, Jonathan's in the back. Okay, just after we partnered with the American Red Cross, in comes Jonathan. So this was the first year we were able to partner with the center, which was really, really neat because we got t-shirts and name tags. So, you know, we had a little, it's always nice to have that kind of funding that makes things just go a little bit better. We were able to give out some neat incentives in the form of first aid kits. And we had, it broadened the partnership. It made us feel like part of something bigger. It wasn't just our little class.
And
it was
the center paid for the Red Cross training of the students.
Of the students. And so it was, you know, not just our class and the community or our class and the rest of UTEP. It was the center and the Red Cross and the UTEP community. And I think it just made it, you know, to me it made us part of something bigger and a little bit better. The goals this year, again, were the same: to increase disaster preparedness among our audiences and also to increase the perceived competency of our students. So they've been out there. Of course, we don't have any results to show you, but these guys are going to do some of the fastest preliminary data analysis you have ever seen in about a 48-hour period, Monday and Tuesday. No, don't worry. It's really simple this year, but we'll hit you up for when we do the comprehensive one. But you're off the hook for the 48-hour quickie. So anyways, in 2 days, you know, after they've done all this, we're going to do some real preliminary, some simple analyses to see, hey, what happened? We had about 200 people that were trained as a result of these guys going out and doing their training. From what I saw, and I know from what Sharon saw, in every case when we went to presentations, the audience had a ball. I mean, here they were getting to see the students in a different, you know, not just running across campus or not, tables were turned, the students were the educators, library staff meetings, the entire graduate school staff, safety meeting over at facility services for 50 people. These guys have really done some neat work. And I think the students had fun just actually getting out, you know, instead of just having your nose in the book and studying for the test, it was, you know, let's go do what we do and let's go do what we know how to do, want to do, and someday are going to get paid a lot of money to do instead of paying tuition to do. So, so the good news, I think, is everybody had a lot of fun and it was very successful just from the standpoint of us getting out there and doing it. Now, we like to call this communitizing the health education curriculum because we kind of infuse the you know, the content of the coursework and what you're doing in class with what's actually going on out there in the community. The students get an enhanced understanding of some of the issues people face. Health literacy we talked a lot about today, but that's one of the things that, you know, until you actually get up in front of a room full of people and start talking and get an awareness of, number one, how interested they are, number two, how much knowledge they may have about something, and it's hard when you're going midstream and all of a sudden you see a lot of blank faces and you're like, uh-oh, you know, I thought I used this book, I developed this curriculum because that's what I thought my audience was going to be, and now I'm having to adapt and work with it, and so, you know, I think it's a really good lesson for everybody to be in those situations. Definitely facilitate some community and academia partnerships between the Red Cross, the center, everybody kind of work together, more people are aware of what we're doing. There's people on campus, you know, the grad school, I had an email from someone at the grad school who basically just raved about the professionalism and the quality of the presentations that the students gave, and you know, their impression was, boy, if this is what we're going to get in grad school, we're in good shape, because they, you know, they were really impressed, and so I think the students got some good exposure. One of the things about diversifying the scientific community, which I think sometimes we take for granted here, because look around the room, we see a lot of Hispanic health educators, right? We see a lot of Hispanic researchers. We brought that up in the beginning with Dr. Castaneda's talk about the need to diversify the scientific community. We don't notice when we look around the room here because we're used to seeing each other in our university, in our border region. But nationwide, this 3% just kind of stuck in my head. I was doing some research for another class last week, and in the same issue of American Journal of Public Health, and they talked about the need to increase diversity in the ranks of researchers. 3% jumped out again and again and again. Percent of physicians in the American workforce that are Hispanic, 3%. Okay, that's in 2005. 3% of the physicians. So some of these issues we talked about today, about communication and cultural awareness, that would probably be a little bit different if more than 3% of physicians were Hispanic. Number of PhDs awarded to Hispanics as a percentage in 2005, 3%. Okay, so again, pretty small number compared to the population of Hispanics in the United States, 3%. Percentage of NIH funding awarded to Hispanic principal investigators. What do you think? 3%, okay, across the board. And that 3%, that's got to change. And what's happening, I think, today, this is a perfect example of what got showcased today was not only ways to increase our research capacity in terms of what we do here at the university, but addressing what has been, you know, a whole issue of American Journal of Public Health, the biggest journal of public health, devoted to nothing but the need to do just that. We're responding to that need. I mean, we probably didn't show up here this morning thinking about that, but that's what we're doing. The need to have intensive, purposeful, and intentional mentoring of researchers. That's what this is all about. I mean, I look around the room and I see Dr. Moneta, Dr. Castaneda just left, Dr. Tamaka's here, Dr. Thompson's here. They do that mentoring every day, but I guarantee you they get something out of that mentoring too. You know, they may be the mentors 90% of the time, but the mentees that they're working with enhance their ability to do research because they're asking different research questions, they're conceptualizing different ways of thinking about how to design a research study. They're bringing different things to the table, different ideas, different interests, different backgrounds, and it benefits the mentors in ways that I think we as mentees don't think about very often. I'm kind of in the middle at that point. You know, I get a lot of mentoring from those people I just mentioned, but I also do I get to do a little bit of mentoring with undergraduates and sometimes with, you know, with my own students where I teach. And so it really is it's an ongoing and it's a circular process. And I think that the intentional nature of it, the intensive nature of it, I mean, look at the outcome today. We have a whole bunch of really well done and well presented research out there in the hallway, and I didn't see a single doctor as first author on those presentations. So I think you guys who presented should really be thinking, wow, I contributed a lot today and I have a lot to contribute. And you students who are here in the blue shirts having done this community education stuff, you're next, and you are, you know, you're what's going to make research better. So I thank you for the opportunity to work for you and with you, and look forward to doing more of it. And I thank particularly the center for kind of bringing everybody together from the community, from UTEP, from outside, and helping us to develop not only a better research community here at UTEP, but for contributing to the development of a better and more diverse research community in the world. So you guys are it. Thank you very much, and happy Friday.